How do you specifically partner with your healthcare companies to build out these effective hiring processes and teams for growth?
Yeah, it really is a partnership. I think many of the organizations that we've seen that are within our ecosystem just tend to take the spec and they say, yep, this exists, we'll go find it. We push a lot and we push back. We want to make sure that the people that you're bringing in are going to be the right individuals for your organization. Are they going to be additive to the culture? And are they going to be an accelerant of your business? So we press a lot on those assumptions that the company has. The other thing that I think makes us pretty special, and one of the things that we try to do within every collaboration that we strike, is actually to bring some fun and joy to the hiring process. I mean, so when I was at Startup Health, one of the things that I heard over and over again was a company just raised money. And they're like, I have to hire a VP of sales. I have to hire a head of product. I really need to bring in an advisory board for clinical engagements and initiatives. And it all of a sudden, it had this sense of urgency and panic and just, you're barreling through, you're going from one challenge to another as an entrepreneur. So one of the things that we actually want to do is bring some fun and joy into the process where you get to be really excited. And instead of saying, I have to hire, you say, I get to hire a VP of sales. Finally, I get to bring in a VP of sales. I'm so excited to have somebody who understands what they're doing, who can get me into the places that I've never been able to get into. This is going to be so much fun. We've had a lot of interactions with our clients recently, when one in particular who, no joke, used the word delighted when we talked about a candidate. He's like, I'm so delighted that this person was just presented to me. It's like, I didn't think that was an emotion I was going to have on a search call. So that makes it fun, and just brings a little bit of levity that I think we all need in our day to day, particularly during something that is as important as this.
Yeah, very interesting. And it looks like one of the tools that you work with is the Health Talent Exchange. Could you maybe talk a little bit more about that for us?
Oh, absolutely. So the Health Talent Exchange came up as a response to what we were seeing happen when COVID hit. There were two things that wound up happening. One is that all of a sudden hiring, or people were talking about hiring freezing, particularly because you saw a lot of people start to get laid off. All these companies are cash conscious. Their investors are certainly cash conscious. And so a lot of folks got displaced. At the same time, though, healthcare as an industry and an ecosystem, was in a really unique position where there was so much opportunity all of a sudden. And you all of a sudden had an opportunity to help where you may not have gotten that opportunity before. So now companies need to execute. And now they have needs from the product side, from the sales side, account management that they just didn't have before. So you had this market displacement where you had folks on the one side that were unfortunately let go, and they likely would not have been on the market at all because they would have been doing quite well at their jobs. And then you had the other side of the market is like, oh man, I need to hire, or I need to backfill. And so what we did was we wanted to create a space where companies could list the open jobs that they had, or the most urgent jobs that they needed to hire for. And these brand new candidates or talent pool could search for them and do it completely for free for both sides of that network. It was really important for us to be able to democratize this and to have it be a space that was authentic and that was accurate to the jobs that are being searched for today. Because listen, looking for a job is rough at any stage. And with everything that was happening with COVID, it was even more of a vulnerable time for people to be in. So we just wanted to make the process a little bit easier. And it's been working really well so far.